In today's Eye on Health, right now, across the country, there are more than 113,000 men, women, and children on the National Transplant waiting list that then would fill Heinz Field, PNC Park, and Highmark Stadium.
About 3,000 of those people are waiting for a life-saving heart transplant. Our next guest is one of the lucky ones. He received his match and a successful transplant at Allegheny General Hospital 3 years ago.
Yeah, it's pretty incredible. Welcome Eric Daughenbaugh and his doctor, AHN cardiac surgeon and head of the heart transplant program at AGH, Dr. Steve Bailey. And thank you both for being with us.
Thanks for having us.
Thanks. Yeah, and doctor, this is just so incredible that we're even having this conversation, because 20 years ago, this wasn't possible, and you save people's lives now with this.
Yeah, maybe 30 or 40 years ago. Yeah. It's actually been around for a bit longer than 20 years. But yeah, it's a wonderful, really modern medical miracle that we can take a heart from a very gracious donor and implant it in a patient who's going to die without it, and have the the great outcomes that we see with Eric and our other patients. So it's a real blessing.
And Eric, you strike me as being younger, and this is not something that I would think would have happened to you, a whole heart transplant.
Right. I had congenital heart disease. I was born with a defective heart, and we knew over time that it was going to continue to get worse, and that eventually I would need a heart transplant to survive. My mother passed away when she was 38, and here I am 49 years old. I had the same condition she did, so I've already outlived her by 11 years with all of the advancements in technology.
And so this is a genetic condition that you had to deal with, and then you got put on a waiting list. And how long ago did you have the heart transplant?
It was December 9th, 2016 was my heart transplant.
Okay. And you have an incredible recovery story, because you just told me we have pictures of you running.
Yes, I became a runner because I always wanted to be a runner.
We don't have the pictures, but we'll have you tell the story.
I always wanted to be a runner, so after my heart transplant, I felt so good that I approached my doctor and asked him if I could run a marathon. He said, sure, go for it. So in 2018, I ran the full Pittsburgh Marathon.
And what is your prognosis now? I mean, it's all full steam ahead, or is there still concern because you have a transplanted heart?
It's full steam ahead pretty much, and I go through, they follow me regularly, and do the standard, blood work checks and other checks, but pretty much live my life, do what I want to do.
Fantastic.
Now, doctor, is his case pretty common?
It is, yeah. So there, across the United States, there's nearly 3,000 heart transplants performed per year. But there's many, many, many more people with heart failure, and so there's a variety of other techniques that we use to help people with heart failure, whether it's an artificial heart or a temporary LVAD, which actually Eric had before his transplant. He had a machine implanted in him to get him safely to transplant while he was waiting for an appropriate donor. But Eric's a fantastic patient, but I think very emblematic of the great outcomes that we see with heart transplant these days.
Now, in Eric's case, it was a genetic condition, but what about for so many other thousands of patients where this is happening? I'm assuming based on maybe some lifestyle choices. What are some of the reasons that this is happening and so prevalent?
Yeah, so there's a number of congenital or inherited diseases like dilated or idiopathic cardiomyopathy. The heart just doesn't work well for various reasons. Probably the number one reason is ischemic cardiomyopathy, or heart that doesn't work because of bad coronary artery disease, and in its end stage leads to heart failure and a need for transplant. So sometimes patients will have had coronary bypass or coronary stenting as a way to prolong the life of their original heart before they come to heart transplant.
And the survival rate for this at AHN is really pretty incredible, isn't it?
Yeah, so it is. We're just these outcomes are publicly reported by the UNOS database, and we're happy to have the best 3-year survival, about 93% in the state of Pennsylvania, and the top 5 in the country. And that's really attributable not so much to the surgeons involved. We got a great surgical team, but the heart failure medical team that Eric can tell you about, and our transplant nurse coordinators, and all the related services work very much as a team to help our patients and get them through this, and end up coming out the other side, looking and acting like just a normal patient.
Yeah. Well, speaking of the other side, Eric, I'm sure your outlook on life has completely changed.
For sure. I do everything I wanted to do that I couldn't do growing up. I became a runner. I'm working full time. I play golf 3 times a week. I bowl. I bowled my first 300 game this year. And,
That's fantastic.
So
What a wonderful outcome, and thank you both for coming on and telling this story, because I think it can help a lot of people.
thank you. Thanks for having us.
Thanks, guys.
Well, and to learn more about the transplant team at AHN, go to PittsburghTodayLive.com, because we have a link for you posted right there.
And keep watching for our Eye on Health series here on PTL. It's every other Wednesday, sponsored by Highmark Blue Cross Blue Shield, together with Allegheny Health Network for your health.